Hey everyone, welcome back to Startup Health Now, the podcast where we celebrate the entrepreneurs and the innovators who are transforming health. I'm Logan Plaster. Few trends in healthcare have grown as quickly and spread as widely as the use of AI. Of course, AI has been a foundational technology in healthcare for years, but something shifted when ChatGPT came on the scene. All of a sudden, everyone from patients to investors to the buyer at the hospital saw in tangible ways how this technology was going to make all of us more efficient and solve problems that had previously seemed pretty intractable. One of the companies that's riding this wave is Mediktor. They were using AI before it had its cultural moment, and now they're growing rapidly. What they do is provide an AI-based symptom assessment that helps to stratify patients and guide them towards the most appropriate level of care. My guest of the show is Cristian Pascual, CEO and co-founder of Mediktor. I wanted to have him on, not just to talk about his company's progress, like their recent acquisition, but get into the challenges the healthcare industry is facing in regards to the use of AI. As you'll hear, there are still many health tech companies that use black box AI models that allow for hallucinations. But according to Cristian, there's a better way forward, a hybrid model that taps into the best of AI while creating appropriate safeguards for accuracy. Let's get into the interview. Here I'm with Cristian Pascual, CEO and co-founder of Mediktor, and I wanted to take you on a little walk around the floor to talk about generative AI and LLMs, because I know that you are building your platform on this technology, but you also have sort of an interesting take on it, particularly what some of the challenges are to this technology. So kind of unpack how Mediktor uses AI and LLMs, and then we'll get into some of the challenges.
Okay, so, well, in fact, today we don't use LLM.
Okay.
We will incorporate this technology, but I think the challenge today is
Large language models.
Yes, thank you for that. So I think the challenge today is about the hallucination effect related to this technology, and the challenge to comply with all the requirements that you need in healthcare.
Okay, so hallucinations, every now and then we're going to get just a false answer. Like if I'm on ChatGPT or I'm using one of these AI engines, I'm going to get a hallucination.
Yes.
And you're saying in healthcare, no bueno.
No, this is not good. Nobody will like that. And well, it's difficult to manage this, right? So I think this is a very important point to everybody that, like me, love ChatGPT and these tools build up on this technology, but to leverage the potential of these technologies in healthcare, you need not only LLMs, but other technologies to comply with that and to be able to provide the safeness and the compliance with all the regulations.
Okay, so the large language model, the LLM, to simplify that for our audience, is that like the body of information, the body of data that you're pulling from?
Well, I think this technology, it's extremely nice and good to manage, let's say, broader spectrums of conversations with the user, to put a framework in the conversation, but not to provide a really safe conversation with the patient and provide the medical outcome of that. So on Mediktor, we use AI, but not on with LLM. We don't provide the results based on LLM outcomes. We provide it in a spectrum that is close, and we can always explain why a result is shown.
Okay.
And that's important, right? To provide this safeness.
Okay, so just so I understand, instead of saying that, like there's this AI LLM black box, we're not quite sure how the response came, you're able to actually point to evidence, you're actually like clinical workflows, standards of care.
Yes.
Okay.
That's the point. And I think black box technology related to healthcare is a huge challenge to provide this evidence, to provide this confidence. And I believe in a combination of technologies to provide these outcomes that are proven at the same time of leveraging the high potential of LLM technology in healthcare. So I believe that the best technology is a blend of technologies that provide a safe and also the best possible outcome.
Okay, so the safest side is going to be the closed system where
Yes.
you know where everything comes from, and then you've got the, if I'm hearing you right, the LLM side is more of the black box?
Yes, it's the black box and maybe more the broader reach or broader understanding that can provide then as an outcome a framework, but not the result.
Are you concerned about people's use, startups' use of Gen AI
Yes.
and overlooking the challenges of hallucination?
No, absolutely. I mean, I think that a lot of people is using ChatGPT to provide conversations in the medical field, and I think that's even dangerous to do it.
How dangerous?
A lot, because it's not complying with anything and can provide even bad outcomes. So you cannot tolerate that. And I think that's something to avoid. It's attractive because it's easy to do it.
Yeah.
And you put just a fancy layer over it and you use it on behind, but it's dangerous and it's not complying with what you should.
Okay. So what should a startup that's maybe dabbling in that area but doesn't have a huge team to tackle some of the LLM challenges, what should they do to be safer?
Well, I think, again, it's a difficult question because we need to set a specific framework in the solution you are willing to provide. If you are providing general advice and it's not really linked to a result or a clinical action, well, you can leverage that. But when it comes to a more serious recommendation or to be specific, then you should avoid that and build models that are white box and easy to explain the results and give this advice that can be always trusted.
Yeah. It's such a rapidly evolving field, and like it's crazy that we just saw it feels like ChatGPT just came out, and there's all of these new GPTs, new applications. It seems like it's daily and it's switching so fast that it can be hard to think about, okay, well, what's next and then what's after that? But you're in this rapidly evolving field where you have to think that way. So I'm curious, where do you see this going? Where do you see Mediktor? I know you just bought Sensely. Where do you see Mediktor 5 years from now? Do you think sort of as a futurist sometimes? Like what's beyond what we have now?
Well, we are building now a platform. It's a conversational bot. We'll expand our capacities in many ways, but I think having broader spectrum of conversations with the user, more natural, more human-like, and now we incorporated new voices that feel more natural. So more easy for everybody, even different levels of literacy and kind
of what I'm hearing you say, because what you're describing is currently available in some way, shape, or form. The avatars, the voice, like I've seen it, and what I hear you saying is going deeper and deeper. So more white box, more clinically valid, better human interaction, but not necessarily like a whole new technology.
No, I think it's blending technologies and at the same time providing the trust, which is the key thing. I mean, at the end, you will need to convince the medical community that this is safe, and they need to trust on it. So, and I think that's the most important angle, because regardless of the fanciness or easy to use, that needs to be there, needs to be trustable. If not, it will not happen.
It's a really fascinating angle. It's almost like 1 year it's Gen AI, and then the next phase is trust. So the idea that like we're moving from like the tech to the intangible, and we got to figure out how to wrap around trust, and that may be even harder than developing Gen AI.
No, of course. I mean, it's a totally different angle. You need to prove that the outcomes are right. You need to put clinical trials. You need to validate. You need to have use cases, and to put all these together takes time and effort.
Yeah. Well, Cristian, thanks for taking this walk with me and helping us get smarter on LLMs, and I wish you the best.
Thank you. Thank you very much.
Thanks for listening to Startup Health Now. We'll be back again with another episode next week.